Good morning, ladies and gentlemen. It's your host Obinna Okeke. Welcome to Beneath the Surface, and this is the second episode of our mental health. And then the last time I promised to talk about continue the program, and let's recap on what we talked about in the last program. So we talked about the overview of mental health. And then we defined mental health and we showed the definition of World Health Organization of mental health. We talked about the importance of mental health and how the mental health impact our well-being. We also talked about the kinds of factors that affect in the mental well-being. So we started with biological factors. We talked about psychological factors. And then we ended up with socio-economic factors. And then we will move over to common medical disorders that affect our mental health. So, they are anxiety disorder. We talked about it as well. So, but today, we're going to be moving over to mood disorder. So, let's dive in. Mood disorders such as depressive disorder or bipolar disorder involve persistent change in our mood, energy, and activity levels. So this is a kind of a disorder that we always get when our mood always changes. And then we have a kind of two different kinds of personality. And then this involves the persistent change in the mood. Sometimes your mood is good, sometimes your mood is not good. Your energy level rises, and then it goes down. Your activity levels is inconsistent, and then that affects the way you behave in the society that you find yourself. The symptoms ranges from hopelessness, loss of interest in some kind of exercise, and it is elevated by mood and impulsive disorder. So psychotherapy, medication, and lifestyle modification is a cornerstone for this treatment, and this has also been enumerated in so many textbooks that treated mood disorder. Early detection and support network can be a mitigating factor that will help to elevate our mood. So let us go to another kind of disorder, which is psychotic disorder, notably schizophrenia. Schizophrenia is a kind of double personality. It involves distorting thinking, perception, and emotional responsiveness. So this kind of disorder is also associated with your psychic mentality. So it is a disorder that gives you two personality. It is a hallmark of distortive thinking, and your emotions is fluctuating, and the responsiveness is very, very, very low. Hallucination, delusion, and disorganized speech are hallmark symptoms. You always see two things. You hallucinate, you talk delusionally, and then disorganized speech are hallmark of psychotic disorder. Antipsychotic medication, psychosocial intervention, and community support is a way to help people that have such illnesses. And these are essential components for long-term management. Ongoing research seeks to redefine treatment approach and reduce stigma. So if you have a person that has such a problem, then you seek to treat the person, definitely. And it will help to reduce the stigma that the person is having. So, effect and impact. The consequences of mental health disorder extend beyond clinical support, affecting individuals and family and its entire community. So, if you have this kind of illnesses, the effect can go far and beyond. So, let's talk about the individual effects. We will start about the individual effects. This reduces the concentration and motivation, and empowers energy for the academic and job performance. So if you have this disorder, it will empower definitely your kind of academic disorder, because it will not be focused and laser focused. Your speeches will be impaired and the way you talk will be affected. So, sleeping disturbances, you'll be finding it difficult to sleep, finding it difficult to concentrate. Sometimes you feel like somebody's after you while nobody is it. So these are signs and symptoms of individual effects in psychotic disorder. So appetite change. You don't eat so regular. You come out in the morning, you're not hungry. Afternoon, you're not hungry. Unless the things that empowers you to eat, you take them. That's when you now find appetite to eat. And this will be, in a long term, very bad for you. So, somatic complaints co-occur with emotional distress. So, substance misuse and then self-harm behavior often emerge in maladaptive coping mechanism. So in this kind of substance misuse, when you misuse substances, it will affect you individually in your psychotic disorder. So this is not good, and then we don't hope to get ourselves involved in this. So also, you talk about family and communal effects. So the caregivers, the burden of the financial constraint when families members provide unpaid support, this affects the family and also affect the community you are in, because they have to go far and beyond to help you look for the ways to adapt in the community you find yourself. So this is a financial constraint on your family and also on the community that you having. The stigma and misunderstanding are fractured relationship drive affected individual into isolation. So the individual that suffers this kind of problem, they try to avoid it by going into isolation. Therefore, they are not socially associated with people around them. So making them to isolate themselves, and these fractures on the relationship they have between themselves and the community they are in. So the productivity decline as on mental illness, fuel absenteeism, disability, and incarceration. So the incarceration that you get will probably affect you directly, and then because you're mentally sick, and it will push you inside, and then you don't associate with the people around you, and then possibly incarceration, or you incarcerate yourself, and this is how the society lacks people that can help them to be very productive. So let's now go over to diagnosis. Accurate diagnosis is a gateway to effectively treat people that has this kind of problem, relying on standardized criteria for clinical judgment. So clinical judgment is a very, very nice one, because these are well-trained professionals, so they could help you to treat this kind of problem. So when you take the people that have such illnesses to professionals, and they clinically diagnose them, so it will help them to improve on their treatment. A thorough diagnostic interview explores symptoms, history, duration, and functional impact. Structures tools such as the DSM-5 and ICD-11 categorically and dimensional framework for classification. So this is a very powerful tool to diagnose somebody that has this kind of disorders. So it is called DSM-5 and also ICD-11. So screening instructions like the PHQ-9 for depression and GD-7 for anxiety enables early detection in primary care and community settings. This will help very, very powerful. This is a very clinical judgment that is required for effective treatment of the people who have this kind of illnesses. So another one is the collaborative assessment with family members, teachers, or employers. Provide contextual insights and informs treatment planning. Wonderful. So if you collaborate with the community and the family of the person involved, they could help them to do what? To get an informed treatment plan that will help people that have such a diagnosis. Treatment approaches. Effective intervention combine evidence-based therapy, pharmacological option, contemporary support tailored to an individual needs. So the individual needs is required to have an evidence-based therapy so that it will help them psychologically, and then contemporary support will be also an effective means of treatment, which we're gonna dive into. Now, for example, this kind of psychotherapy treatment, so it is called cognitive behavioral therapy. It is a well-structured form of treatment which helps people with distorted thinking pattern and will build adaptive skill to help them in coping with their illnesses. Another form of psychotherapy treatment is dialectical behavioral therapy. So this one teaches an emotional regulated and interpersonal effectiveness, especially in the borderline personality. People that has schizophrenia, for example, or hallucinating. Dialectic personal therapy, DBT, helps to teach them and regulate their interpersonal effectiveness. So another form of psychotherapy is interpersonal therapy. So this one targets relationship conflicts and the role transactions that precipitate mood disturbances. So interpersonal therapy is also a very good way to treat this kind of illnesses that is associated with disorders. So it is being advised to take them to professionals so that they can have a well-structured pattern of treatment to get the people that are mentally ill in check. So let's go down to pharmacotherapy. Antidepressant, mood stabilizer, and antipsychotic correction neurochemical deregulation is a very well and a very nice structured plan to treat people with certain kind of disorder. Medication requires careful titration. If you go to lab and then all the results are out, and then with medical treatment, and they will monitor the side effect and the periodic assessment of the efficacy. So it's a well-structured pattern of treating people with mental illness. So a combined therapy or psychotherapy plus medication yield supreme and quality outcome in many mood and anxiety disorder. So this is a very, very recommended way of treating people with disorders. So it's been recommended. So another contemporary and emerging treatments these are new forms of treatment that is being recommended also. They are not well structured like the clinical ones, but they are very powerful too, and they are contemporary in the new emerging treatments. So it's kind of mindful meditations, yoga, acupuncture, stress reduction, and emotional imbalance. So it's been recommended if you can have a very mindful, if you don't want to go down the path of, even if you're going down the path of this structure, well-structured one, you can still join it with this. So it's another form is transcranial magnetic stimulation and kinetic infusion therapy should rapid relief in treatment and resistance of depression. This one is a very powerful one, and it's also a kind of a emerging treatment. So psychodialectic assistance physiotherapy, currently in clinical trial, holds a promise for PTSD and existential distress in terminal illness. So this one is also very powerful. So you meet your GP so that they can help you structurize the form of how to get this treatment done. This is a powerful tool. So education and courses. Structurized learning equip professionals, caregivers in the public and well-skilled, recognized and response to medical needs. So education is a very powerful tool, and it helps us in doing what? In structurizing and helping the people that has a mental illness. So university degrees in clinical psychology, psychiatrics, social work, and counseling. That's also powerful. University degrees that you have in psychology, psychiatric and social work, counseling. These are very powerful education courses that can help in the borderline and mental health issues. Online certification courses in mental health first aid, trauma-informed courses, and suicide prevention are kind of courses that will help to treat mental illness. Continuing professional development courses on cultural competence, digital therapy, and integrated course mode can help in designing a course model that will care for people that has a mental problem. So it will be encouraged to go for professional development workshops so that will help in digital therapy and integrated care models. So community seminar led by peer support organization that teaches stress management. That's a powerful tool as well. So let's talk about the case studies that people had while they are in the university. So this one is the university with anxiety, a university student with an anxiety. So he's 20-year-old law student. He's experiencing fear of public speaking and avoidance of classroom participation because he has a mental issue. So CBT section over 12 weeks combined with exposure exercises helped him and helped with his cognitive restructuring of his negative belief. So it helped him powerfully because he has a 2 weeks exposure in the exercise. And this was a very good example that he did what? He rebounded back. By the end of the seminar, the student delivered a moot court argument confidently and reported a 70% reduction in anxiety scores. That's powerful too. So the second case study was a working adult with major depressive disorder. He is 35-year-old and he is presently having a persistent low mood, insomnia, and following the problem because he was laid off from his work. So the treatment was combined by selective serotonin and inhibitor, the one we inhibit, and with IPT, a focus on career transaction and stress management. So after 4 months, the client secured a new role, re-establishing social connection, and reassured weekend hiking and activities. Powerful. So promoting mental health. Building resilience and preventing disorder requires strategic at individual, community, and policy level. So this kind of treatment will help the individual to have a very powerful strategy to deal with the resilience and prevention of these disorders. So if individuals participate particular sleep hygiene, regardless of whatever they do, they have to have a physical well-being before they could participate in anything that they do in the society. This is very, very important because they have to have a regular exercise, regular activities, emotional regulation technique that they will use to imbibe themselves and then join in the society and the community they are in. So school integration, social emotional learning helps the teachers in training people with mental literacy, to educate people about the mental literacy that they feel. It has to be in part of the curriculum that they teach in the school. Workshop adapt flexible schedules, mental health days, and the employing assistance program. These are kind of programs that will promote mental health, and it's very important and very vital when we have to keep our mental well-being in check. So government enforcing prior laws. So fund clinical community clinic and support public education campaign. This is where the government comes in. They will help to enforce the laws that would help people to do what? To be promoting mental health in the community. They can fund community clinics and also support public education campaign. to promote mental health, because this is a very serious illness in our society. So government should come into this role. So the role of technology is also to digitize innovation and expanding excessively, and personalizing and measuring of mental health care. So you have technologies that we can wear to measure how we sleep, how we walk, how this will help us to regulate and to know whether our blood pressure is in check. And monitor this kind of very, very vital things in our lives. Smartphone apps offers mood tracking, guided breathing exercises, and then CBT models. Exactly how I said it, and it's a powerful role and a powerful tool. Teletherapy platform connect clients to licensed professional and regularly regulate their mental health in the geography they find themselves. Wearable sensors detect physical and making it stress-free. Such heart rate visibility would help with early prevention. If you wear those things in your hand when your heart is beating irregular or when your mental check is not in check, you can actually consult your doctor instantly. So the role of technology is very, very important. Artificial intelligence, chatbots, 24-hour supportive mode, and then the use of appropriate services can be very, very vital. So reducing stigma. This one will be very effective in the society because people are being shamed for having mental illness. So reducing the stigma could help. So the effort can be the attitude can change the language around mental health and dismantling barriers to care. So people should encourage to care for people with mental health so that the stigma will be reduced in a very high profile. Then we have to employ high-profile ambassadors to share recovery stories to dehumanize mental illness. School hosts anti-stigma assemblies that challenges myths and foster peer empathy. In the school, you have to imbibe it. Have the assembly, teach people that mental illness is not their fault. So by this, we reduce the stigma that we have. So media's guideline encourages respect portrayals of mental health in news and entertainment. So again, media is a powerful tool because when it comes into your ears, it enters your head and it stays there. So if media plays a very vital role in this, encouraging people to not to shame people with mental illness, it will go a long way to reducing the stigma that we have in mental health. Workplace policy integrate mental health into broader diversity and inclusive framework. So in the workplace, you introduce it to being part of your policies. So policies and advocacies. Systematic change requires alien policy, sustained funding, and stakeholder collaborations. So national mental health strategies set targets of workshop displacements and service encouraging and outcome measurement. So you set up policies that will encourage people to draw lines and check whether people are abiding by the laws and policies to avoid stigmas for the people that had a mental problem. Insurance mandates ensures mental health parties and physical health benefits are in check. So you encourage policies in the workplace and in the society to do insurances against your mental health. So this will be another very powerful one. So crisis helpline, mobile phone response, suicide prevention hotlines forms essential safety networks. So this is self-explanatory, where you call in to report issues that with mental health. That's what is going to be part of the policies that should be adopted to help us prevent mental health stigma. Research grants accelerate innovation in digital therapy, neurobiology, and population health intervention. So that's a very good one as well. So inconclusively, mental health is a fundamental component of human flourishing that intersects biology, psychology, and society. It brings unify the biological problems that we have, the psychological problems they have, and the societal problem we have. We unite it to help the society to flourish. By understanding the cause, recognizing the effects, employing rigorous diagnostic process, and delivering an evidence-based treatment, we can address a full spectrum of mental health needs. So when we understand the causes of this mental health, we recognize it, and then employ a rigorous diagnostic processes, we will deliver a wonderful spectrum in mental health care for the people that has it, educate them through courses and community programs, empower the stakeholders, and then a real life example demonstrates a successful strategy to deal with mental illness. Also, technology can be another powerful tool because it will help us to deliver all these things through wearable sources and then trackable sources, so that it will help you navigate around, and when you have this kind of problem you can easily go to professionals. Mental health is not static, it grows with time, and the more we adapt to it, changes to it, our community will be a very thriving one. It's being encouraged to have conversations, have advocacies, and compassionate action to pave way for the resilience and thriving in the society. So if we have conversation, if we learn how to put policies, advocacies, compensate actions, our mental health will be improved, and people with this illness will be cared for, taken good care of. So the essence of this podcast is to throw more light, enlighten people, tell them, so that the mental health will be promoted and the society will guard against too much mental health. Thank you for your attention to this matter. Thank you so much for listening to our program. If you have not subscribed, please do so. Like and share to your people. I am happy that you are joining us in this program. Thank you so much, and see you in the next episode. My name is Obin Naukeke, and this is Beneath the Surface. Thank you so much.